Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video about patients who are stuck essentially on chronic antimicrobials. That could be antibiotics, other pharmaceutical antimicrobials, or it could be herbal or otherwise non-pharmaceutical antimicrobials. So, for example, someone who says, I feel better when I'm on these anti-yeast herbs or fluconazole, but whenever I come off of them, I feel worse. And that might be whenever I come off them completely, I feel worse almost right away, or I feel fine when I come off them, but then a week or two or a month later, my symptoms come back, or even when I lower my dose, I start feeling worse. Or another person might say, as long as I'm taking my antimicrobial herbal mixture, then my symptoms of persistent borreliosis or Bartonellosis or Epstein-Barr virus or whatnot feel better, but if I try to come off of them in some way, shape, or form, then I start to feel worse. So I've had many patients dealing with those issues before. Sometimes they're patients who I've inherited from other NDs who or other clinicians who come to see me to kind of get a second opinion or fifth opinion or whatever it is, or they're patients of mine where I'm treating them, they're feeling better, but then I find that I just can't seem to get them off their antimicrobials. And so when that happens, in my experience, it's oftentimes an indication that person has some type of a underlying hypersensitivity to the microbe in question. Sometimes it's related to biofilms. That does come up as well. But in my experience, oftentimes it's because that patient has a hypersensitivity to that microbe in question. And so what's happening there? So the patient is on their antimicrobial. Let's just say it's a patient with chronic digestive issues. They're on herbs to treat their SIBO or their yeast or something like that. Feeling a lot better, but they try to come off the antimicrobials. All their digestive issues come back. So what's happening there? Well, the antimicrobials are knocking down the levels of those microbes, decimating them in all likelihood, and possibly decimating them down to normal, average levels. But if that person's also sensitive to those microbes, if they're essentially having like an allergy to the microbe, then once, let's say this is the amount of yeast in a person's intestinal tract that the average person can tolerate, and if it gets too high, then they start to have significant symptoms. So the herbs come in, they lower the level down to say a normal level, but if a person's actually allergic to that yeast, their immune system's reacting to it, then that might still be too much yeast for that person. And so the person needs to keep working with herbs or their fluconazole or whatnot to get their levels squished all the way down so there's just hardly any yeast there at all. Then the immune system says, oh, there's so little yeast there, I just don't really have anything to react to, so the person's not having any symptoms. But then they try to come off their fluconazole or their oregano essential oil or whatever it is that they're working with, the levels, don't really do this with my hands. I'm not a hand model on the side, as you can tell. Let's see, so they have a tiny amount, they start to come off of their antimicrobials, their levels start to increase a little bit, not even maybe all the way up to where a normal person's level of yeast might be, but then there's enough extra yeast kicking around that the immune system says, there's some yeast, and then it comes and attacks it, and then the person has this big inflammatory response, and that might manifest as gas, bloating, constipation, diarrhea, heartburn, reflux, itchy skin, whatever it happens to be. And so the clinician and the patient would be thinking like, oh, I guess the yeast is regrowing. And so, we didn't get it all. It's like, well, maybe it's just been that there's actually a hypersensitivity component to it. And really, as I like to say, the proof is in the pudding. And that if the clinician says, oh, let's double down, let's put you on, a longer course of antimicrobials, or let's go after biofilms, or let's switch up the antimicrobials to try to, get after those really super persistent, stronger yeast that might be in those colonies, and then it works, and then the patient, comes off their antimicrobial, and then, there's no flare up as the levels go back to normal. It's like, well, maybe that's what was going on. Maybe it wasn't a hypersensitivity, but if you're like, no, I tried you on different antimicrobials, even stronger antimicrobials, try to get off the antimicrobials, the levels increase a little bit, and then the immune system starts attacking those microbes or reacting to those microbes and having this inflammatory response. That type of pattern, in my experience, strongly indicates that there is a microbial hypersensitivity going on. So the solution to that, there's a few therapies that can be helpful, but in my experience, low-dose immunotherapy is one of the most effective therapies for addressing that. In my experience, it's the most consistently helpful, the most for lack of a better word, kind of reproducible therapy that can be helpful, that can work to address that type of issue. So I've posted about low-dose immunotherapy before, and if you search through my videos, you can find that information just around like what is low-dose immunotherapy, how does it work, how's it applied and whatnot. If anybody watching the video wants a refresher on that, I'm happy to do another video post about it, or if somebody has a specific question around this, I'm happy to post another video about that. But the long story short is, in my experience at least, bearing in mind this doesn't constitute medical advice to anyone listening, but in my experience, if patients are, quote unquote, stuck on antimicrobials, they just can't seem to get off them, or else they flare, especially if they flare really easily, really quickly, like within hours or days of coming off of their antimicrobial or lowering their dose. In my experience, that's a really big clue that there is quite possibly a microbial hypersensitivity going on, and low-dose immunotherapy can be very effective. If you're thinking to yourself like, I wonder if there's low-dose immunotherapy for this infectious microbe that I have, the answer is probably yes. There are so many of them out there. Now the answer is, with that being said, it's not always that the thing that you're being treated for is the thing that we necessarily use the LDI for. So, for example, the Epstein-Barr virus LDI, a lot of people will test positive for chronic or reactivated Epstein-Barr virus. They're being treated for that. They feel better. Wonderful. And yet, in this kind of scenario, if a person they're like, I try to come off my antivirals, I feel worse. It's like, maybe I need Epstein-Barr virus LDI. Epstein-Barr virus LDI almost never works. It's one of the most unsuccessful LDIs out there. However, those same folks might respond really well to the Borrelia burgdorferi LDI, which is the causal microbe for Lyme disease, or they might respond really well to yeast LDI, or they might respond really well to strep LDI, and those formulas work on a very regular basis. So it's not always super obvious in terms of which antigen formula, which LDI formula might need to be used. But again, regardless of whether we're treating EBV or something else that's less commonly effective with LDI, it's something that it can still indicate that the person might be dealing with some type of a microbial hypersensitivity. Maybe it's just not the thing that they were being directly treated for in this case. So anyways, there's lots of little nuances around LDI. I could talk about it all day. I have talked about it all day because I've taught a 2-day training course. Or was it a 1-day training course? I don't remember now. It was a few years ago. Anyways, I talked for a really long time about low-dose immunotherapy, and so I could talk about it all day, at least for 1 day, if not 2 days. But I'll leave it there for now. If there's any questions, please post in the comment section below, and I hope that this was interesting.